Hello, true health seekers. This is a very special episode because I took my equipment and I went live to a naturopathic conference that was happening at Bastyr University. So I decided to break this episode into two parts. Today's episode is going to be with Dr. Denis Wilson, who is one of the leading doctors in reversing thyroid conditions naturally. He also uses T3 therapy, but he loves to focus on what lifestyle changes and what herbal remedies and natural remedies and supplements that we can use to heal the thyroid and heal our body and our metabolism naturally. So enjoy part one of my excursion to Bastyr University. I'd love to thank all of you because we've, about 3 days ago, hit 500,000 downloads. And that's in less than a year of running the Learn True Health podcast. So let's pat ourselves on the back and celebrate. We are now completely blown past, way past 500,000 downloads, and we are chugging along to reach our goal of 1 million downloads. Definitely going to be surpassing that very soon. So keep sharing the podcast because we're helping so many people. Just like I know today's episode is packed full of great information. You know, I got to sit down with Dr. Wilson in between lectures. He was lecturing. He was the keynote speaker at this naturopathic conference, and he was so eager to sit down with us. And I asked for 5 minutes. He gave us 16. But he gave us so much information in this interview. And he promised me that he would love to come back on the show at a later date and do more. But this, what he did give us is some great information, and he lists off the things that we can start to do now to heal our thyroid, and he explains the difference between having a thyroid problem and having a metabolism issue in which the body's not utilizing thyroid correctly. And so it's really, really interesting, his research and what he's doing to help people correct their thyroid. Now, I also would like to let you know that we're running a contest right now. So you can go to learntruehealth.com/contest, and I'm going to send you a prize for doing something that it'll take you less than 10 minutes, and it will help to promote the podcast and help us to reach more people and help more people. And I'll also be sending you something awesome. So before the contest is over, please go to learntruehealth.com/contest. It will be ending soon. You'll want to go there as soon as you can and complete the form. It will take you less than 10 minutes. And in doing so, I will send you something fun. So thank you so much. I'll be releasing part 2 shortly. And in part 2, I interview some of the vendors that were at the naturopathic conference, specifically labs. These labs are on the cutting edge, and they're paving the way for how naturopaths can diagnose different ailments. So looking into not only, how's your white blood cell count and how's your, cholesterol and all those very typical things you think that a doctor would test for, but these labs help us to determine how many environmental pollutants are in our body, or how many heavy metals are in our body, or how much pesticides are in our body. Really interesting, because then if you're working with a naturopath or working with your doctor to do detox, you'd want to take the test before, and then you could take the test after, and you'll see a significant drop in all of the pollutants and heavy metals and all these things that are really unhealthy and lead to a lot of disease. What's really interesting as well is your doctor would want to do these tests to see maybe which type of cleanse or detox would be best for you, because in some circumstances doing a sauna would be good, and in others it wouldn't. And so by looking into your body and seeing what's going on, your doctor can best determine the course of action that would be best for you. So that's in part 2, and enjoy part 1, which is right now, with Dr. Denis Wilson. Are you looking to optimize your health? Are you looking to get the best supplements at the lowest price? For high quality supplements and to talk to someone about what supplements are best for you, go to takeyoursupplements.com, and one of our fantastic True Health coaches will help you pick out the right supplements for you that are the highest quality and the best price. That's takeyoursupplements.com. Takeyoursupplements.com. That's takeyoursupplements.com. Be sure to ask about free shipping and our awesome referral program. Welcome to the Learn True Health podcast. I'm your host, Ashley James. This is episode 98. It is a beautiful, crisp, clear Saturday. The sky is just, there's not even a cloud in the sky. And it's just one of those wonderful days where you can't even wear a jacket. It's so beautiful. I'm on the campus of Bastyr University, which is the Naturopathic Medical School just outside of Seattle, Washington. And today I'm here at the AARM Regional Conference, the Association of the Advancement of Restorative Medicine. All of our favorite naturopathic doctors are here doing continuing education credits. And so in today's episode, we're going on the road, live and in person, to talk to some of the vendors here. They've got a lot of great labs and really interesting information. You know, talking to some of the naturopaths, they're geeking out. They're so excited to talk to the vendors. And of course, then we bumped into my three favorite naturopaths, Dr. Heidi Samani, Dr. Brooke Whites, and of course, Dr. Megan Saunders. We had a wonderful lunch here. And then I got to talk to Dr. Wilson, who is the top leading doctor when it comes to restoring the thyroid. Those who have had thyroid medication their whole life, those who've had thyroid issues, or those who maybe their MD has told them they don't have a thyroid problem, and yet they continually suffer from all the symptoms of hypothyroidism, of low thyroid function. Dr. Wilson has a wonderful news for you and wonderful information. I'm so excited to bring you today's episode from Bastyr University. Well, I'm so excited to have here Dr. Wilson, and you are the leading expert in helping people recover their health when it comes to thyroid issues.
Thank you. Yeah, we've noticed a long time ago that a lot of times people can have a low body temperature and they still have all the symptoms of low thyroid function, even when their TSH is normal, even when their thyroid blood tests are normal.
And for our listeners, what is your website?
WilsonSyndrome.com. It's Wilson S Syndrome. WilsonSyndrome.com.
Now, a lot of my naturopathic doctor friends told me that you are absolutely the standard when it comes to recovering the thyroid health naturally, and they all said that you're amazing. And they really they look up to you. They put you on a pedestal, and they say you've been doing this for something like 30 years?
Yeah, it's been a really long time. I guess I first started into this about 1988. So, yeah.
What led you to want to specialize in helping people with the thyroid?
I had a patient come in and she said she asked me to help her. She's been going from doctor to doctor and she had all the symptoms and she had normal blood tests and she also had a book with her that talked about how people can have low temperatures and still have symptoms. And it was a book by Rhoda Barnes called it's called Hypothyroidism: The Unsuspected Illness. And she asked me to read it, and I put it down for 3 weeks, but eventually I did pick it up and read it. And the main thrust of that book was that the body temperature is a good indication of metabolism, a good indication of thyroid function. And Dr. Barnes's approach was to give people T4 containing medicine like Armour Thyroid for life. But one thing that I found that I didn't plan on it, but accidentally found out that sometimes when you give somebody T3 therapy instead of T4, sometimes their temperature can go up and they can wean off and they don't have to take medicine for life.
So you like to help people wean off of medications and help them heal their thyroid and find the root cause.
Exactly. And that's one thing I'm really excited about herbal medicine as well, because a lot of times you can help people restore their health with herbs and nutrients, and restore their thyroid function that way. And they don't even need to be on thyroid medicine to start with, or if they are, they don't need to stay on it.
So if someone knows that they have a thyroid condition, so hypothyroid, for example, what are the things that they should do naturally?
Avoid stress. They would want to declutter and simplify. They'd want to eat organic food if they could. Avoid gluten. They'd get good exercise, like especially what it's called high-intensity interval exercise, which involves kind of like interval training where they get their heart rate up, and they would also want to take iodine and zinc and selenium, and there's other herbs like Google myrrh or blue flag, or sometimes they'll need adrenal support like ashwagandha or eleutherococcus or rhodiola or holy basil. There's different herbs that help for adrenal and thyroid function. That's really good. Iodine is sometimes hugely important, but when all that fails, or at some point they might actually need T3 therapy to reset their thyroid hormone pathways. They actually need to get off T4 and get their T4 and reverse T3 levels down so they can reset their pathways. It's not so much the gland, but it's the conversion in their body that's imbalanced, and it's like rebooting your system. So just like you turn off a computer and you shut down all the pathways, and then you turn it on again, and it comes online layer after layer and it functions normally. It's kind of like that.
That's amazing that you can really help the body get back to the functioning point it's supposed to be at. Like you're helping the body recognize the blueprint of perfect health.
Exactly. And you're right. It's really amazing. I mean, the body is designed to help us do what we want to do or need to do, and we have a lot of things at our disposal, from plants and nutrients. It's all there, and sometimes it just needs a push in the right direction or some guidance, and sometimes you can turn the thyroid function down to where the TSH is very low, the T4 is low, the reverse T3 is low. And then when you let the body come back up again, it comes back up with clean pathways that function correctly, and it's functioning normally again.
Is that like epigenetics?
Yeah, I would, there are some similarities there, yeah.
Excellent. And if someone had had a lot of thyroid problems and they really haven't had a great experience with their MD, because the MD just keeps them on a drug for the rest of their life, and they really want to make that change, can someone hire you to work with them? I know you're in Florida, but can people around the world, we have listeners around the world, can they work with you on Skype, or how do you work with patients?
What we normally do is we have on that Wilson syndrome website, we do have a listing of physicians there all around the country and different parts of the world. And when they, and doctors, they can find a doctor listed there, or if they want to work with their own doctor, they can call our 800 number, which is 800-420-5801, and they can call us, and we can work with their doctor on a case-by-case basis to train their doctor basically how to help them.
Oh, that's wonderful. So someone doesn't have to leave their doctor. Yeah. They could encourage their doctor to learn your method, and you'll work with them to help them. That's wonderful. And what about supplements? Do you have your own supplement line that you recommend?
Yes, we have. Our company is called Restorative Formulations, and we sell to physicians, and those physicians use it in their patients. So it's strictly for physicians, or to physicians. So that's one thing that's handy for them to. But yeah, if they have a doctor that will work with them, we can explain on a case-by-case basis exactly what they should try and how they should dose it and everything like that.
And I know that everyone is different. Kind of on average, if someone has, for example, hypothyroidism, they get their doctor to work with you, or they go see a doctor that knows your protocol, how many months should they expect to start to feel and see a difference?
Sometimes people can notice a difference within hours, sometimes days, usually within weeks. And
really?
almost certainly within a few weeks, they'll be able to tell a difference. And typically, they might need treatment for 2 or 3 months, but it could be 4 months or longer. It could be, a year or 2 years. It just depends what they're trying to accomplish and need to accomplish.
And then those who have a Hashimoto's thyroiditis, what could you recommend for those people?
Well, there's a lot of nutritional support that they can use. Sometimes they will need some T3 therapy. Sometimes it can be corrected if it's caught early enough. And there's lifestyle and dietary considerations to make. But if you can't, if that's not enough, they may also need T3 therapy as well to get their temperature up and try to sort things out.
Wonderful. And I'm sure you've written a book or two. What books do you recommend those who are interested in healing their thyroid read?
Well, we have a wilsonsyndrome.com. If you go to that website, if they go to the patient area, there's a patient area. And there's an electronic book there that they can read online for free.
Oh, wonderful.
That explains all of this. And in the doctor's area, there's actually a doctor's manual they can read for free. It's simple enough that they could understand it, and their doctor could understand it as well. And they can read that online for free as well. So those are two great resources. I do have another book that my most recent book is called Evidence-Based Approach to Restoring Thyroid Health, and I think it is available on Amazon. It's available at Restorative Formulations, our company. But that book is got a lot of references in it. So for a doctor that's thinking about treating patients this way and wanting a lot of scientific evidence to back it up, that's an excellent book for that.
Wonderful. And for those who have or think they have hyperthyroidism, right? And now, just a myth bust here: do more people suffer from hypothyroidism than hyper, or is it kind of across the board the same amount of people?
I would say many more people suffer from low thyroid function than high thyroid function.
Got it. And so for those who think, or I've been told they have high thyroid function, what would you recommend that they start doing?
There's actually herbs for that as well. And the next step, other than herbs, would be anti-thyroid medicine. Like a lot of times doctors will give patients medicine and then sometimes if that isn't enough, they give radiation to kill the thyroid.
Oh my gosh.
Or surgery to remove it. So one thing, for sure, what we would recommend is herbal support first, because a lot of times it's very helpful.
Right. Have you been able to help people so they didn't go get their thyroid burned or cut out?
Yes, exactly. Yeah, so there's a lot of people that would have normally had to get their thyroids removed that are able to get their thyroid function under control.
What percentage of people in the United States suffer from thyroid issues?
The ones that show up on blood tests, I would say about 3%. 3% of people have hypothyroidism that shows up on blood tests. Probably 10 times more than that are people that have the symptoms of hypothyroidism and low body temperatures, even though their temperature's normal.
Got it. So that there's a big chunk of the population where their MD would not catch it, and yet they are suffering from a thyroid imbalance.
Absolutely. I mean, they would be suffering. There's 30-40% of the population that has low body temperatures that are contributing to low thyroid symptoms. Now, one way to get a low body temperature is to have bad thyroid gland function. So your thyroid gland is supposed to supply you with enough thyroid hormone for you to have a decent temperature. Well, there's some people that have a low temperature even though their thyroid gland is fine. So their thyroid gland, so they don't have, quote unquote, it depends what you mean by thyroid. Thyroid's an adjective. It's an adjective or it's a noun. It's a thyroid, the noun, the gland. Now, a ton of people don't have a thyroid gland problem, a thyroid noun problem. They don't have a thyroid problem. But they still have the low temperature and all the symptoms they would have. They have a thyroid adjective problem. They have a problem where they don't have the metabolism that they need, most likely because in in the peripheral tissues of their body, they're not converting T4 to T3. And so they're not generating a decent temperature, and consequently they have all the symptoms they would have if they did have a thyroid noun or thyroid gland problem.
And do you have tests that would allow someone to accurately figure out if they do have a thyroid problem?
Yes. We have one test is the way you can sort this out, really with a high degree of accuracy is you check the TSH, which every doctor checks. And then there's this other test that's called the thermometer. So you put the thermometer in your mouth and you measure your temperature. And the temperature, I like to say the temperature isn't a good measure of the metabolic rate. It's an exact measure of the metabolic rate, because that's what the metabolic rate is. That's what a thermometer is, like a speedometer. So when you have a thermometer outside and it's showing that it's warmer outside, what that literally means is that the molecules in the air are moving faster. So it's showing on the thermometer that things are moving faster. And same it is in your body. So when you're taking your temperature, you're determining your metabolic rate. How fast are you moving? How fast are your molecules moving? How fast are your systems moving? How fast are you living? And the faster, you might have a fever, you might have an illness that could affect your temperature. But guess what? If your temperature goes up, that means your metabolic rate is going up. So it might be up because you have a fever, but still your metabolism is up. That's what fevers do. Mm-hmm. That's how your body responds to an infection, is it increases your metabolic rate so you can deal with the infection.
So what temperature should someone start to have caution around?
98.6 is normal, but when it gets, typically people that are complaining of symptoms, their temperatures will be less than 98 on average during the day.
Got it. Wonderful. This has been very fascinating. Thank you so much for taking the time to talk to us about how we can heal our thyroid. And it's very fascinating to know that there are people out there who are suffering from the symptoms, but their MD would say they have normal thyroid because their test, is not 100%. They're not looking for all the other signs.
Right.
Wow. Thank you so much. Do you have any parting words that you'd like to leave our listeners with?
No, just thank you very much for interviewing me and helping us get the word out there. And I guess the one thing is that for them to keep listening and learning and searching for answers, because there are answers. They can find help. They, whether it's with this problem or any other problem. And if they look long enough and keep at it, they'll find solutions to their problems, and hopefully they'll be successful.
Thank you so much.
How would you like to learn from top naturopathic physicians? Go to freedoctorcourse.com and sign up for the free course that'll email you videos with tips and tricks to achieving optimal health. That's freedoctorcourse.com. freedoctorcourse.com.